Welcome back. It's 11:23 on the nose. Treating depression could come from a simple blood test. According to a recent study, a blood test could determine which drugs may be effective in treating depression. Joining us today is our WPTV medical expert, Dr. David Soria, to talk a little more about this. Thank you for being here, Dr.
You're welcome.
Soria.
Good to see you, John.
All right, you were telling me this isn't a new treatment, but exactly how does it work?
Well, this is really good stuff because, for 350 million people worldwide, it is all trial and error. There is no way to be able to say, okay, you have this type of depression, and so you require this type of medication. And then to make things even more difficult, it's not like a pain medication or antibiotic where you know within a couple hours or a couple of days that it works. It could be up to 12 weeks before you actually realize that that medication may not be working. So what they did in this study was they looked at a group of depressed patients and they measured a couple of biomarkers that detect inflammation in the bloodstream, and they tied that to depression. And when they found that a third of these patients had the biomarkers in their bloodstream, they match it up with the first line drugs, which are serotonin reuptake inhibitors like Prozac and Zoloft, and they actually realized that 100% of those patients had those biomarkers, the first line drugs didn't work. So in other words, when you have that inflammatory marker in your bloodstream, we know not to use those medications because they're not going to work, and we could very well have just saved you 4 months of not only cost, but side effects, but using a drug that could be ineffective.
Well, using this method, would you still need to take that particular drug, or are there other forms of therapy that it might prescribe?
Sure, you bet. So that's the first line that typically doctors use when treating depression. But there are others. There are others that are out there that are more effective, maybe treat a different type or have a different mechanism as far as how they work on the brain. And so absolutely, if you have that biomarker in your bloodstream, we know then, based on this study, that those medications probably will not work, and we're going to jump to the second line or even third line medication to treat your depression.
All right. Hey, sounds
so it's
good.
very cool stuff.
Anything that helps. That's
no
right.
question about it.
So
this is
simple
exciting.
blood test. And how long does a blood test take?
Right now it's only in its study form, so we don't know, but typically it'll be available in less than 24 hours, or at least that was the case in this study.
That's a good place to start.
It'll be ready right away.
All right, Dr. Soria, thank you again.
You're welcome.